Hello everyone, on behalf of Moja Ramesh Amitis Health Tourism Company, I hope you're having a good day. As you know, this is our second session of videos explaining about procedures that we offer to you and the patients for medical treatments. On our last session, we talked about rhinoplasty and briefly reviewed the procedure. Today I'm going to talk about the preoperative and postoperative instructions that applicants of this surgery need to have in mind. Thank you for being with me for the next 10-15 minutes. Okay, before anything, for rhinoplasty, there is one thing that you need to consider, and that is the appropriate age for rhinoplasty. For this procedure, the patient or the applicant needs to be physically and mentally mature, and they need to have stopped growing, especially physically, for the nose to have taken its shape, and that is not going to change in the next years. That's what I mean by being mature. So for women above the age of 16 and for men above the age of 18 to 20 is the appropriate lower age limit, and the upper age limit is it is recommended to not to be at above 55, because as we age, as you know already, the nose and the skin of the nose lose their elasticity, and that makes the procedure more challenging, and the recovery, of course. One more thing that you need to consider is the type of nose that you already have. Some people, we have two types of nose generally. Fleshy nose like that of mine, that when you touch it, it's soft under your finger, and the cartilage is usually weaker than the bony nose, that is the other type. And often the procedure is more challenging for the fleshy nose, as the nasal skin usually is oilier and with larger pores, and the tissue of the cartilage is softer and weaker than a bony nose, and the surgeon may have to reshape the nose, may have to add cartilage grafts, and these all make this procedure for the fleshy nose more challenging than a bony nose. Sorry. Now I'm going to be more specific about the pre-operation instructions. The first and foremost is that you need to have an extensive and comprehensive discussion with your ENT specialist that is going to perform the procedure for you. The surgeon will examine your nose apparently and physically, and you need to express your expectations of the nose that you want to have. And it's recommended to be realistic expectations. And after that, the surgeon will need a complete review of your medical history and overall health. You will have to go through some lab tests, like to examine for blood disorders like anemia, infection, or blood clotting disorders, etc., etc. These are especially important for the procedure, during the surgery and for the recovery. There is going to be an examination of the function of your heart, usually through electrocardiography of your heart. There is going to be an X-ray of your chest to examine the function of your lung, especially because your heart and your lung need to be capable of going through the 2 or 3 hour anesthesia. These are especially important. And other blood tests, as I discussed, and there's going to be a pregnancy test for women, and I think that's about it. Oh, and sorry, a CT scan of your nasal area to closely monitor for deviations, polyps, or an examination of your sinuses. These are especially important for the surgery on the nose. And now let's consider that you have considered a date for your procedure. It is especially recommended that for 2 weeks before the surgery, you need to have stopped taking blood thinning medications that are usually non-steroidal anti-inflammatory medications like ibuprofen, aspirin, or herbal supplements and medications, or vitamin E, as they have blood thinning properties, and these will interfere with the surgery as they increase bleeding during the surgery or after the surgery. So that is especially important. For the time before your surgery, you need to maintain a healthy diet, usually high in protein, like chicken meat, for example, as they will improve the process of recovery of your nose. If you're a smoker, you need to stop smoking for 2 weeks before the surgery and 2 weeks after the surgery. And you need to stop taking alcoholic drinks before the surgery, days before the surgery. And one more thing that is important is that you need to avoid sun damage to your nose skin. So it's better to protect your skin before the surgery, use sunscreens, etc., that you already are familiar with. Avoid tanning or sunbathing, etc. And these are the main things that you need to take into consideration before the surgery. On the day of the surgery, the surgeon will give you the prescription for the recovery as recommended by the surgeon. One more thing especially important is that from the midnight of the night of your surgery, you need to stop eating and drinking, even water. And on the day of your surgery, if essential, if you need to take medications, for example, you can have a sip of water with it. So it's especially important to avoid drinking water and eating. On the day of the surgery, one more thing that I need to tell you is that you should have a companion with you to drive you to the center and drive you back to home, because you will not be able to do so. You need to be accompanied by someone. Now, as I said, you shouldn't eat or drink from the night before the surgery and on the day of the surgery. And one important thing is to wear loose-fitting clothes that you fasten on the front or back by buttons or zips or anything else. You should not wear clothes that you need to go over your head, as they might disturb the nose. So that's one thing that you need to consider. On the day of the surgery, you must not wear any makeup or even nail polishes as doctors recommend it. And no contact lenses for the eyes. These are for the day of the surgery. Now, after the surgery, Usually if you're going to have your surgery in other countries like Iran, as you might use our services, you will usually have an overnight stay at the hospital. So that's one thing that you need to consider. For after the surgery, for about 2 weeks, you should and I emphasize, you should avoid blowing your nose, because it will hurt your nose, and sniffing back is okay, or you should sneeze with your mouth open, because you should avoid any shocks to the structure of your nose. As another point, as prescribed by your surgeon, the nose needs to be moist, usually by saline sprays, or Vaseline for the stitches. It needs to be the stitches need to be soft and not dehydrated. After the surgery, you will have the cast or the splints for about 5 to 7 days on your nose, and it will be removed on your next follow-up session with your specialist, and he will remove it for you. In that time, you should avoid any manipulation or disturbing of the cast. You should keep it dry. You can take baths or showers as long as this area is kept dry. After the surgery, bruises or swelling of the under the eyes or the nose is normal and it's nothing to worry about. Usually you will be given ice pads to soothe or to subside the bruises and the swellings. More importantly, for your diet, you should avoid having foods that need prolonged chewing, as especially for your upper lip, it should not be manipulated at any cost. You don't touch it, don't play with it, do not have any excess facial movements, at least for the first 48 hours. And one thing is that your upper lip may be numb for days, and it's normal and it's nothing to worry about. For brushing your teeth, you need to use soft brushes and doing it actually softly. So one of the most important things is that you need to avoid any extreme activities. It can be any kind of sports or intercourse. You should avoid them, and maybe after 3 weeks you can gradually resume your activities. That you should avoid swimming for 4 weeks at least. That's because in swimming the chance of being injured is very, very high, so you need to have this in consideration. Wearing glasses, if you wear glasses, wearing the glass over the nose may be okay, but after removing over the cast, after removing the cast, the doctor will give you instructions on how to use glasses without putting pressure on the nasal bridge. But wearing contact lenses is completely okay. Again, after the surgery, you need to avoid sun exposure, sunbathing or tanning beds, or any kind of exposure to the sun that comes to mind. that's it. And one thing to consider is that bruises and swelling are normal for at least 2 weeks after the surgery, and it's nothing to worry about. And for some people it may take up to 6 months. And the final shape of the nose, it can take up to a year to refine and manifest itself. I think I've covered the most important instructions for before and after the surgery. And if you have any questions or any concerns, you can contact us through Instagram, Facebook, on our website, WhatsApp, etc., etc., and we will get back to you as soon as possible. Again, as I discussed before, we can offer you 3 packages: the bronze, the silver, and the golden package that cover the expenses of the surgery and the lab tests, clinical visits, imaging, etc., etc., all that this particular surgery requires. We will have beside you a translator. You will have your transfer and free. One of our packages has no accommodation, the bronze package, and the next 2 have 7 days of 7 days of accommodation and 3-star or 5-star hotels at the city of your procedure. And there will be a 1-day city tour and 1 meal, usually a welcome dinner for you, our treat. And I think that's about it. And the visa process, for the medical visa for this process, is actually our responsibility if you're going to use our services. I think I've covered all that comes to mind about this rhinoplasty surgery, and keep in touch with us and we will get back to you as soon as possible in case you have any questions. Thank you for being with me and have a good day. Bye.